Welcome, everybody. We're going to get started in just 2 minutes. Hi, everybody. I see folks still joining, and we're going to get started in just 1 more minute. All right, folks are still joining, but I think we should get started. Welcome, everybody. It's really good to see you. I'm seeing familiar faces, familiar names, lots of folks that we've worked with, that we've got lots of love for, that have helped build the movements that we're talking about today. Really good to see you all in this space. Welcome to the Health and Housing for All, a Research and Communications Toolkit webinar. My name is Will Dominy. I'm HIP's Housing Justice Program Director. I'm going to do a little bit of orientation to the day, and then we'll hand it off to Suk to take us into the toolkit itself. And I know folks are still joining. Please, as you join, do a little bit of an introduction in the chat with your names and your pronouns and where you're joining us from. And again, welcome everybody. I'm Will Dominy, HIP's Housing Justice Program Director. So next slide, Sari. So today we're going to do a couple things. I'm going to give you just a very brief orientation to who we are. Then we're going to get into the toolkit itself and really dive into some of its pieces, understand how to use it. We'll do some of that with our advisors, the organizers who helped us build the toolkit, and also in conversation with you all. And then we'll end with a call to action. Next slide. And we wanted, before we go any deeper, I want to acknowledge the many nations on whose traditional territory we're joining from. And we acknowledge them as the past, present, and the future caretakers of this land. And we honor that practice to lift up the stewards of the land that we occupy, and also to acknowledge that those communities are still here and still leading our movements for justice. And it's one way of showing respect and a step towards correcting the stories and practices that have erased or try to erase Indigenous peoples' history and culture. And this is especially important for our housing justice work and really help us ground in returning land to Indigenous control. I'm joining today from the lands of the Ohlone people in what is now known as Oakland. And Ohlone folks continue to lead efforts to decolonize this land and lead all of us towards a more liberated future. I also want to acknowledge the Black communities and Black-led movements for justice that have flourished here and in other parts of the country, and that are currently fighting gentrification, at least here in Oakland, and for the right to stay. And note that we all live and work in a country that's built on forced labor and stolen lives of enslaved Africans, and is deeply rooted in the systems of slavery, Jim Crow, mass incarceration, housing discrimination, and continued racial trauma and oppression. Anti-Black racism has been one of the strongest forces shaping housing in this country, and it's created deeply divided and unequal cities. And so we want to acknowledge and lift up all the people who unwillingly and forcibly gave up their labor, lives, and homes in the development of what we now know as the US. And we want to lift up and acknowledge all of their descendants and those who continue to fight for freedom and justice across this country. So let's carry both of those acknowledgements with us today. Next slide. So today, you're going to hear from a number of us. You're going to hear from myself and then Sophie and Suk, who led the development of this toolkit here at Human Impact Partners. You're going to hear from our advisors, Francisco, Tomas, and Lupe, who advised in the process of this and have been thinking with us deeply about how we really integrate this work into housing justice movements. Very briefly, if you're not familiar with HIP, we're a national nonprofit based here in Oakland that seeks to transform the field of public health to center equity and build collective power alongside social justice movements. We do that through organizing with our public health field to be in deeper relationship with other movements, through direct policy advocacy and capacity building with governmental public health and action-oriented resources to confront the root causes of health inequities. And I'm seeing a real mix of folks in the room today, many of whom we know you from your government kind of side work, and then a lot of organizers as well. And I think that's typical of the approach that we take here at HIP, of really leveraging the power of both sectors as well as those of us in nonprofits to build our movements for justice. So next slide. Very quickly, I just wanted to ground in why are we working on housing and health, and give you a sense of how we think about it here at HIP. We've traditionally thought about the connections between housing and health through the lens of quality, affordability, and stability. Quality, I think, is really self-explanatory. It's right. It's like, do you have mold in your walls? Is your child safe from lead poisoning? You know, all the things that impact our daily lives of just like the physical quality of where we live. Affordability is, you know, can we make rent? Can we afford it? Are we making trade-offs where we're skipping medicine or skipping meals in order to pay our mortgage or our rent? And then stability is can we really stay in the homes and the neighborhoods that we live in and not be forced to move? And that's the framework that we've traditionally used. And I would say, like, we've also started adding thinking about climate change and racial justice or injustice. For climate change, it's increasingly clear that things like Katrina or Maria force like massive displacement from folks' homes and neighborhoods. And then also the quality of our living conditions are also deeply impacted by climate. I know I'm thinking a lot about just like indoor air quality during fire season, for instance, and the climate impacts look different in other parts of the country. But increasingly, many more of us are thinking about, is our home safe now and then in the course of climate disasters? And then, of course, racial justice. Our homes and neighborhoods have always been shaped by white supremacy in this country, or not always, but since colonization. And white supremacy has used housing policy as one of the most effective tools of racial injustice. Segregation, redlining of the past, and then continued exclusionary policies and disinvestment and continued discrimination based on race, involvement in criminal legal systems or immigration systems, continue to shape folks' housing opportunities. And our homes are where all of those things show up, and they're the places where we can address them. If our homes and neighborhoods are in right relationship with the earth, if our housing policies uproot racism, then we can start to move towards a more liberated future. And getting there is going to take all of us stepping into responsibility from wherever we're situated. So government institutions like code enforcement or public health, we need to develop and uphold standards that protect us all, that keep us all safe and housed. Landlords need to follow laws that protect tenant health and stability. And we need huge organized social movements to really make sure all of those things happen. Which brings me to the last part I want to cover here, which is power. And I think we're increasingly adding this to how we understand housing and health. None of the rest of these pieces work unless tenants, BIPOC communities, poor and working class communities have the power to shape the future of their neighborhoods and homes, to push back on an abusive landlord, to hold our government institutions accountable when we need to be, to own the buildings or own their whole block. And then and only then are we really going to have healthy housing. So we're increasingly thinking like, both what are the technical fixes, but then underneath all of that, what's the power that we really need to move towards housing and health? The last thing I'm going to cover before I hand it off and if you could go to the next slide, is our growing housing justice program. HIP has done work on housing justice for many years. And I want to just specifically lift up Sophie and Suk and Megan and other former staff members who built this work here. And also, we've never had dedicated staffing until this spring. And so we're really launching and formalizing and growing our housing justice work. And we're doing that through three main strategies. The first is really changing the frame by conducting campaign-focused research, and then also supporting the public health field to be powerful communicators about housing and health. So that's what we're doing today. We're building a new base of support by convening public health allies to build our power as a sector and loan that to our housing justice organizer friends. And then we're bridging public health agencies and organizing by connecting those and building strong inside-outside partnerships to really get to the kind of power that we need to win structural change. And with that, I'm going to turn it over to Suk.
Thanks, Will. Hi, everyone. I'm Suk. I'm a researcher at HIP. I use she, her pronouns, and I'm joining from Patwin Land, also known as Fairfield, California. So I'm going to be sharing the rationale behind the toolkit, and then we're going to do a screen share as well. So in the path to developing this resource late in 2021, we started by asking housing organizers what kind of resource would be most helpful at this stage of the pandemic. Earlier that year, we worked with Chainbreaker Collective to develop 2 research briefs and a series of reports on the eviction crisis in Santa Fe. We wanted to understand what a broad and generalizable follow-up could look like, and where we could support in filling the gap in leveraging public health research. And so we heard a couple of things. Data is really helpful. Talking points and framing are also critical. The protections weren't perfect, but they were effective. We also wanted to know what did we learn from those protections, and how do we get decision makers to acknowledge that the housing crisis is entering a new wave. So with the guidance of housing organizers who are on this call today, we developed this research and communications toolkit to leverage for advocates to leverage public health research for long-term housing justice. Our intent is for this resource to bolster the advocacy efforts of both housing and health sectors to build a more just and healthy future. We know that the housing crisis and the pandemic are both still very much at play. So in the next part, Sarah, if you can move to the next slide. So we're going to provide a screen share just to go over the toolkit. And we're going to go over the major sections. There are 4 major sections. And while we do this, thanks for dropping the link to the toolkit, Sophie. So we'll just wait a minute for the screen share.
Oh, sorry. So you're ready for the toolkit screen share? Sorry.
Yeah, all good. Perfect, thank you. Great. So we're going to start with the background, which starts on page 3. So we provide a historical context of the housing crisis that has long existed before the COVID-19 pandemic and takes root in racist, profit-driven, and capitalistic policies that have disproportionately harmed working class people and BIPOC communities. We describe the role that advocates played in pushing for housing protections during the pandemic to keep people housed. And with many of those protections now removed, we're at a pivotal moment to fight for long-term recovery and actualize our vision for housing justice. At the end of this section on page 5, great. We make a point to solidify the role of public health in this work. We already know the clear connection between housing and health that Will has just described. So we can move into the second section of the resource, which is the talking points. And the talking points cover pages 6 through 12, but we'll pause here on page 6. So beginning on, so the talking points make up the chunk of the resource. And to kick off this section, we'd like to spotlight a very helpful and important resource in strategic communications and messaging. Berkeley Media Studies Group has a number of really helpful and great resources that we've leveraged in our work. And Sophie's going to drop the link here. So we invite you to check that out if you haven't already. Thanks, Sophie. So moving into the talking points, which are organized into 3 categories, beginning on page 7. The first set of talking points are very broad and general, so they focus on the connection between housing stability and health, housing quality and health, and housing affordability and health. And then we can move to page 9. And so the talking points on between pages 9 and 10, these focus on the impacts of racist housing policies, as well as how COVID-19 has deepened racial inequities in both housing access and in health. And then on page 11, we shift to what we have learned from the pandemic era housing protections. So we looked at the literature, we conducted a thorough literature review of research published in the past couple of years, and we learned that housing protections such as eviction moratoria, utility moratoria, rent debt relief, and et cetera, all improved outcomes like housing stability. They reduced the spread of COVID-19 mortality and incidents, and they also improved mental health outcomes, including for BIPOC households. And then the next and third section is focused on public data, and that starts on page 13. Awesome. And so in this section, we have a table that lists publicly accessible data sets, and many of these we have leveraged in our research work. So that's on page 14. Thanks, Sari. This is a table. And then on pages 15 and 16, we present case studies of grassroots organizations that have integrated data into their housing campaigns, and the lessons they have learned, the impacts that they had using the data, as well as gaps in the data. And on page 17, which is the last section of the resource, we end with a number of demands focused on long-term housing justice, and also reference some policy platforms that would be great for you all to check out. And that's the resource. And the rest of our time is going to focus on how to put this to use. And I'm going to pass it back over to Will to start off that conversation.
Yeah, thank you, Suk, and thank you for all your work. Suk is like the mastermind of the research behind this toolkit, and really, along with Sophie, led this project. So just very briefly, I want to pitch using the toolkit, and from a starting point of just like public health is one of the strongest frames that we can be using, in my opinion, in housing justice campaigns. And that's something that's borne out by the research. There's been a lot of different research projects lately, message testing, polling, trying to figure out what kind of messages resonate. And across the board, we've seen that health works. And in particular, it works in places where sometimes public health, social justice kind of messaging doesn't, like in places, especially in the more like moderate places, when you talk about something as health, it moves people from like housing as a commodity kind of ways of thinking to housing as something that we all need, should all have, and need to societally be defending. So I just want to like push up for all of us, like this is a frame that works. And it's also just true, right? Like we all need a home. That is just true. It's very important for our health and for our bodies. Here's just some examples of where that kind of frame has been mobilized. From media pieces like this op-ed from the California Nurses Association, from a press conference that our own Sophie helped lead, from research reports like this one, emergency rental assistance, that Francisco and others were a part of, from the work that HIP did with Chainbreaker. And then also around mobilizing institutions, like the report on the right is something that Alameda County Public Health did, where they really mobilized their public health officer, media tools, and others alongside housing justice organizers to really frame out the housing crisis as something that matters for health. Sophie can also put in the chat just a link to an interview that Kathy Schaff from Berkeley Media Studies Group did with Francisco and myself about using some of this health messaging in campaigns. And then just last, like using the toolkit, it's super easy. Like in a lot of ways, I'm kind of our first beta tester. Like while Sophie and Suk were working on the toolkit, I was stealing parts of it to use in our advocacy, and just cutting and pasting and pulling into this letter, for instance, that we worked on this last legislative session. Or our colleague Megan just last night testified at Denver City Council. I wrote her talking points. I just pulled directly from the toolkit. And that's what it's for. It's meant to be copied and pasted. You know, obviously bring your own shine to it if you want, but like, we don't care. Just use the language. We think it's effective. So please use it. I'm going to turn it over to Tomas in a second, and I just want to introduce them. Tomas is the executive director of Chainbreaker Collective and has been with the organization since it was founded in 2004. Chainbreaker is a membership-led economic and environmental justice organization with over 700 dues-paying members in Santa Fe, New Mexico, the bulk of whom are residents of neighborhoods experiencing displacement and vulnerable to gentrification and eviction. Chainbreaker organizes frontline community members directly impacted by housing, transit, civil rights issues, to make Santa Fe a more equitable city. So take it away, Tomas.
Thank you very much. I'm glad to be here. As Will said, my name is Tomas Rivera. I'm coming from Chainbreaker Collective here in Santa Fe, New Mexico, in Tewa land. I think what I wanted to just highlight about this toolkit is how Chainbreaker has used a lot of the buildup towards this to what we think of as democratizing the data. So we are a membership-based organization that focuses on building power from the people most impacted by the issues that we work with. If you'll see, it's not the best picture, but our the first time we worked with HIP was on a health impact assessment in 2014, starting in 2014, to just get a sense of the layout of what was going on in Santa Fe in terms of segregation and displacement. Really what we were trying to do is we were confronted with a bunch of elected officials and funders and policymakers and city staff people that were saying the experiences that our members were talking about of displacement, of gentrification, of discrimination were just not, we were exaggerating or that they weren't as bad as we were presenting them, which is, you know, effectively an attempt to gaslight a community that has already been dealing with that for a long time. Our approach was to work with HIP and to figure out how we can actually put those stories into a format that would be accepted by people with power. But to do it in a way that it doesn't just live on a shelf. And I think that the intention of things like this toolkit is to really have them be used, just like Will was saying. These are about being active and putting them to use on the ground. And so we learned how to do that starting back in 2014, when we took some of those maps that were presented in that report, and as you can see in this picture, blew them up into banners and went to City Hall with them and confronted policies where the City Council was attempting to make significant budget cuts in areas that would have a disproportionate impact on communities of color. So this campaign was effective in making that happen, not just because of the data and not just because of the organizing, but because we're able to bring those two things together and again democratize the data in that way. So we were able to make the stops in the policy, the budgetary attacks, but we were also actually able to move the story forward, not just creating a narrative shift, as is mentioned there, but we started organizing with people in the community saying, look, these maps really tell it like it is, and it's hard to ignore that. And we were able to use that to agitate and to build more community. From there, we created a Residents' Bill of Rights, which is a list of several different policy recommendations that serve as a development guide for the city. And we're able to get that actually passed through City Council all based on organizing through this and reports that came later. That was our first sort of beginning to work and think of this partnership, and also to think about how we can use data in a way that is alive and is about building power. Can you please move the slide? So as mentioned earlier, as the pandemic hit, one of the things that we, as organizations and people all over across the country, of course, it really brought to the forefront that the housing crisis already existed, and it was exacerbated by the pandemic. There was an acknowledgement that there was a threat of mass evictions happening all over the country. We saw moratoria becoming moving in place on the federal, local, and national levels, and state levels. And in Santa Fe, we had also those protections as well. Ours was one of the first to be introduced and one of the last in the country to be taken off. And what we always like to talk about in terms of housing and health is that that was one of the biggest examples of policymakers acknowledging that housing and health are in fact one policy, that they are connected through policy. When people were saying, yeah, you know, people are out in the streets, they are going to spread COVID, how are we going to deal with this? It allowed us to start having a conversation that expanded past COVID. So in focusing on the threats of where evictions were likely to happen, they were really just extensions of some of the maps that we were showing before. The threat of eviction was really correlated to communities of color and low-income communities. These are things that people doing this work, and I'm sure many of the people on the call are not surprised about. But again, using the data in these reports and making it public in this way made it impossible for people to gaslight our communities, and allowed us to target support where the need was greatest. So one of the things that came out of this report was a program of direct cash assistance to renters. Our city was able to put not by paying the landlord, but by giving the renter the money that they need in these targeted areas, prioritizing them, as much as $9,000 over the course of several months, which was actually CARES Act money. So that was very significant policy, and really, I think, wound up saving people's lives. It also, we were able to gain a sense of people started paying attention, right? And not just to our organization and our work, but really saying there is actually something bigger and more that needs to happen here. And really, just to kind of underscore what Will was saying before, is the narrative of understanding the connection between health and housing is what really amplified that and pushed that forward. So as we were doing that, policymakers were unable to disconnect those things, and were put in a position where our members had been building power for over a decade before around these issues, were able to actually confront some folks that were adversarial or just not on the same page with us by using this data, but coupled with the organizing work that came behind it. So it was not just an accountability tool, it continued to build. And of course, you know, the first slide showed 2014 as the beginning of when we started doing this work with it. You know, that is several years later that the pandemic hit. But that's what it takes to build and build. Next slide, please. So under the theme of democratizing data and how this can be used, what I want to just really underscore for folks is Chainbreaker does community organizing and believes in building power for the people most directly impacted by it. This data, this toolkit, all of our reports are about amplifying that data and helping us build more power and hold policymakers accountable. So one of the outcomes of our series of eviction reports was to say these are short-term, mid-term, and long-term policy solutions to this. We knew that the pandemic was going to move into a recovery period, which is starting to feel like we are in. And we know that there's a sense of like everything is great now, we don't have to worry about the eviction crisis anymore. But when we actually are able to look back at this data and say, you know what, this was happening before, it was made worse by the pandemic, and now it's still increasing out there. Here are some policy recommendations that we can actually use here locally in Santa Fe on the state level, and that are models, replicable models that can be used around the country. And that's where this toolkit comes in. One of the things that I think has been most profound for our organization in working in some of these coalition and partnership spaces is understanding that what's happening in Santa Fe is not unique. This is happening in cities all across the United States. And whereas there is a little bit of difference in terms of legal issues, policy issues, where there is power, where there's a history of organizing, at the end of the day, the policy solutions tend to be incredibly similar. So using this toolkit as a roadmap for finding those policies and plugging them into your local communities, and of course in partnership with community-based organizations on the ground doing that work, is really going to be offering solutions to the housing crisis that is ongoing, to our ongoing health crisis for decades to come. So just want to kind of again put out there, if we're going to be putting out reports, if we're going to be putting out data, it needs to be coupled with power building and grassroots mobilization, so that we can actually put some of these things into the practice. The toolkit is a really incredibly powerful tool to either begin that process if that's the stage you're at, or to continue and build on that process for some of you who have been doing this for decades. So I know I'm rounding out on time, and I think that, you know, I guess in the last 2 minutes, just want to say once again, in order to democratize the data and make it a viable option for not just policy, but actually affecting people's lives, has to be connected to the people most impacted by it. Otherwise, we can make gains, but they will be lost. So, you know, these partnerships are really important. This toolkit is born out of that spirit and that actual work. And we are very excited to have folks on here to continue to move it forward. So thank you very much. But I'll turn it back to Will, or to who's next.
I think that is me, so I'm going to jump in. Thank you so much, Tomas. Hi, everybody. My name is Sophie Simon Ortiz, she or they pronouns. I am HIP's organizing project director. I'm also based here on unceded Ohlone lands in the Bay Area, with roots also in the Southwest and across the country and Puerto Rico. It's a pleasure to be here. It was an honor to work on this toolkit. And I now have the honor of creating additional space for you all to hear and learn more from our wonderful advisors on this project. So what we're going to do is have a sort of mini panel with our other two advisors, Francisco and Lupe, and then open it up for you all, because we're really excited to see already a lot of ideas in the chat, and curious what questions you have, and additional ideas that you have in terms of using this resource, but of course also all the additional wonderful resources that have continued to be shared in the chat. So without further ado, I'd love to introduce our next two presenters, panelists, Francisco and Lupe. So Francisco Dueñas is the Executive Director of Housing Now, a California statewide housing justice advocacy coalition since January of 2020. What a time to join as ED there. He was previously the Housing Justice Campaigns Director for the Alliance of Californians for Community Empowerment, also known as ACE. Prior to joining ACE, Francisco was the Director of Diversity and Inclusion for Lambda Legal, a national LGBT impact litigation organization, where he worked for 14 years. He has also served on the Los Angeles City Human Relations Commission, and he's from Southgate, California. And then Lupe Lupe Areola, Executive Director of Tenants Together. Lupe's passion for tenants' rights expands more than 20 years. She's a former tenant organizer and Director of Counseling Programs at St. Peter's Housing Committee, now Causa Justa Just Cause, where I used to volunteer back in the day, from 2001 to 2008, counseling and organizing mostly Latinx tenants in San Francisco's Mission District. She went on to work as Housing and Public Accommodations Investigator with the SF Human Rights Commission and as a Contract Compliance Officer for the City and County of San Francisco, so also that government experience. Lupe served on the board of directors for Tenants Together since its founding in 2008 and was hired as the ED in March 2019. Lupe is a proud Chicana, daughter of Mexican immigrants, and graduate of UC Berkeley with a BS in Ethnic Studies and a concentration in Native American Studies. And for folks who don't know Tenants Together here in California, Tenants Together is a statewide coalition of local tenant organizations dedicated to defending and advancing the rights of California tenants to have safe, decent, and affordable housing. It's California's only statewide renters' rights organization. Tenants Together works to improve the lives of California's tenants through capacity building, movement building, and statewide advocacy. So welcome, and thank you again so much, both of you, for all of your support with the toolkit, your advising, and all of your great work here. So if I could have both of you just briefly, in just a couple of minutes, which I know is hard, if you could share with us just what are your priority areas of work right now? And if you are able to fold into that, kind of how do you plan to use this toolkit going forward? And why don't we start with Lupe?
Sure, thank you. First of all, thank you so much for having us here and having us be involved in this process and this toolkit. I think this is something that we're really excited about to continue to pursue. I think for Tenants Together right now, the priority is, building as much power locally in local communities to pass rent control and just cause locally. And, especially because we know that at the state level, we're never going to get what we want. We are working to build power at the state level as always, but locally, we see that the gains can be much bigger, especially, and the goal is that at some point when we have enough cities and counties that have rent control, that the state will have no other choice but to be able to push for the types of changes that we want and we need. Even though there's been some gains made, but we have a very resistant legislature as always. So that's a huge focus for us. Additionally, we are, one of the biggest projects we've taken on in the last couple of years is our California Eviction Prevention Project, which is a collaboration with Health Leads, which is a national health policy support organization, and with the 211 centers around the state, where we're through the lens of, health and housing, we're training 211 operators around the state on just really basic tenant rights information that they can give callers, and proactively screening folks that are calling for food insecurity or concerns about just even health, about, are you housing insecure right now? Have you received an eviction notice? Are you concerned that you're not going to be able to keep your housing? Because we're looking at how all these issues are intertwined, and the importance of being able to give people that information that could keep them from leaving prematurely, right, into already very hostile kind of renter and housing environment in California, and potentially really destabilizing their health along with their housing and then finally would be definitely the link between climate change, housing, and health is really important to us. We're really starting to delve more into this, and we're actually going to go into our next strategic planning process starting early next year, where we're going to delve a lot more into that, because we're seeing how this is impacting different communities, including drought, including lack of available potable water, wildfires. All these things are impacting people's ability to be able to stay in their homes and to have a healthy home at that.
Thanks so much, Lupe. And yeah, and while I know both of you are based in California, you know, as Tomas said, I just want to underline that we know so many of these struggles are shared across the country and really the world too, in so many ways too, right? In terms of the forces that that your work is pushing back on, right? And so and we also are really excited, you know, to be able to kind of spotlight the particularities of California as well. Francisco, how about you? What are your priority areas right now, and any thoughts about using the toolkit?
Yeah, thanks for having me. Also really wanted to start with appreciating HIP and the other fellow collaborators, advisors. It's been a really wonderful process. So for Housing Now, we're a statewide housing justice advocacy coalition. We mostly focus at the state level, which is an uphill battle, as Lupe alluded to. But I think our approach is trying to bring in and coordinate amongst very large, big, wide tent of coalition partners. So some are folks that work on housing day in and day out, but some might be organizations that are in other sectors like education or climate justice or environmental justice. And so our role specifically is to increase the number of stakeholders that are part of the housing justice movement, beyond just those groups that are organizing tenants or building buildings, affordable housing producers, which we also feel like we obviously need to work together, but how do we grow that movement? And so for us, I think, Will started off by talking about the quality, the affordability, and the stability. And I think for many of our coalition partners right now, especially coming out of the pandemic, the stability and affordability pieces are really important. And we are trying to, every year in the legislature, we look for opportunities to move forward either policies or a budget ask. And so right now we're exploring different options for continuing to push for greater affordability, or at least, stronger rent control. At the state, we don't have that. In 2019, we passed what we called a anti-rent gouging protection, because we didn't have anything like that, anything that really acknowledged tenants as consumers and that should be protected from price gouging. I think with the pandemic and more people heard about price gouging, not just in the context of, rents, but also other essential goods. And so I think a lot of folks are thinking about this now, how it doesn't make sense to not have more protections for tenants there. So we're going to be exploring that further. How do we increase that affordability or try to preserve the affordability that some folks do have? And then also, many of our groups are really interested in what is called social housing, which is sort of how do we bring on more housing options that are not tied to the private speculative market and that are not as vulnerable to price gouging, and so we're going to be also exploring that. That could be like more community land trust or limited equity co-ops. So there's a lot of different models. So all of these things are, going to bring about stronger health outcomes, positive health outcomes for our community. And so I'm really looking forward to using the toolkit to bring that message back to our coalition partners as they are advocating for all of these policy efforts or budget asks.
Wonderful. Thank you, Francisco. And definitely invite you to share, if there's anything around that, the price gouging legislation, just thinking about, how to make all of these efforts, replicated in other places. Definitely invite you to do that, and any other resources around some of those wins, because we have to celebrate the wins too, right? So just briefly too, and I want to make sure we have a little time to open it up for other questions and reflections, but just in a couple minutes as well. This piece around, you both already spoke to this already. So anything you want to add just in terms of the piece around leveraging a health frame, health narrative, and also the really just material partnership pieces of partnering with the health sector, right? Which I know both of you and your organizations have already done really strategically, but I'm curious, if there's anything you want to just add briefly around what's the elevator pitch you would make, for housing justice organizers partnering with the health sector, right? Kind of what do you feel excited about ongoing in terms of doing that? I'm going to drop that also in the chat, and maybe Lupe, can we go back to you also for that?
So I think one of the biggest pitches for me is the fact that the CDC, the Center for Disease Control, passed a nationwide eviction moratorium effectively during the pandemic. And that was unprecedented. I mean, we've never seen that level of eviction protection at the federal level, period, much less from the Center for Disease Control. And whether they knew it or not, they did something unprecedented, and they did something that protected potentially millions of people from eviction around the country. And so to me, seeing the impact of that and the fact that it was able to happen, really for me is really motivating me to really like, how do we really delve into this intersection of health, housing, and really try to further not just the rights around health, but also the rights around housing, because they are so well intersected. I think for us, in terms of how we're going to be using it, like I said, we are, we're working with health leads, we're working with HIP, which we're really excited about to continue. But also the fact that, one specific thing is around habitability. I think for us, like, how do we ensure that folks are being able to get the conditions that they need to be healthy, to be able to stay in their homes, and to do that without the risk of eviction? Right now, it is very risky for folks to ask for repairs because there are so many loopholes in the laws that allow for retaliatory evictions, and they're hard to defend. So, how do we close some of those loopholes so that folks can ask for those repairs, get those repairs, not have their rent increase, and at the same time be able to, stay in their homes long term?
Wonderful. Thank you, Lupe. Yeah, Francisco, just briefly, anything else around working with the health sector or leveraging this frame? And then I'm excited to go to a couple of really excellent questions we have in the chat for you all, if you're open to it. And I'll invite Tomas to jump in too, if they would like.
Yeah, I think I'm excited about deepening these connections between the housing justice sector and the health justice sector. I think that there's so many, there's so much overlap here that, these are really, it's one push. All our housing justice policies are health justice policies, period. And so, trying to, I think, better build consensus and coordination. I think that's what I'm really looking forward to. There are many different policy efforts across the state and obviously across your individual states. What I would really suggest, because I'm seeing some of the questions in the chat, is really trying to find different campaigns that your organizations, your institutions, your agencies can help support. Sometimes that might be like helping to put together testifying during a press conference, or perhaps, helping to put your name on a op-ed or something like that. But I do think some of these, looking at the chat, somebody talked about like the preemption that is sometimes there for states that don't allow locals, jurisdictions to do much. I really think we need to really work collaboratively to push back on those and repeal them eventually, right?
Great, Francisco, thank you. You actually read my mind, or our collective mind here, in terms of collecting these excellent questions coming in. I wanted to go to that question around preemption in just a moment. But also to say thank you both so very much, for your work and for engaging here. Please continue putting questions in the chat. I think we have more than we can answer probably within the time. And so we'll be following up with all of you, anyone who registered, and of course, all of you who are on. And I think we'll do our best to also answer them perhaps by email in that follow-up, because there's some really juicy, great stuff in here. And just to name too that, that the piece you're naming, Francisco, in terms of all the ways that health sector folks can engage, testifying, signing letters, et cetera. That's where we come in, and what we, I think is our bread and butter, and what we're so excited to continue bolstering, in our sector, as Will laid out with our expanded housing work. And so just a kind of invitation for you all to, all of you who are on, right, in the health sector in particular, to stay engaged with us. And we'll talk more about that in just a moment, some specific calls to action that we have. But first, let's go to a couple of these questions. So I'm going to drop that preemption one back in there. And thank you. I'm going back up to see who asked it. Sorry, I lost it. Either way, it's in the chat. So a person in Wisconsin is asking about preemption, right? Like you named. I'm curious any thoughts you have around that. So the Wisconsin legislature prohibits local jurisdictions from any housing related policies, for many housing related policies, including conducting even routine inspections of rental housing. Inspections only occur when renters report a situation to public health or to building inspection. Any thoughts of you all, the panelists, but also honestly, like opening it up, all of you have the ability to unmute yourselves if anyone has thoughts around this, of any guidance on what local jurisdictions can do to overcome state preemption when it's really limiting in this way.
Yeah, this is a huge issue around the country. Actually, many states, I believe over 20 states actually around the country have preemption laws on the books that prevent them. I believe it's, I can give you the exact number, but many have, the preemption around local jurisdictions, which is, and that's actually been tried in California. There's been initiatives that have been gone forward and laws at the state level that they've tried to pass to actually create this kind of preemption in California, which we fought back many times. So I think in those cases, it's even more important that local jurisdictions and local groups, the local groups really press on their public health sector, that local groups press on their building inspector sector, to be able to push for those changes and to push for those repairs and to push for those rights, because they're the ones that actually do have the ability to do that. And in terms of the way that people get repairs or get an inspection, I mean, to be honest, a complaint system is really the only system that's in most states and most cities. I don't have top of my head like cities that have like a proactive inspection system for individual units. San Francisco has like a proactive every few years inspection system for some buildings, for some residential buildings, but most places have a complaint-based system. So I think that's not going to change anytime soon, but definitely to the preemption, this is where like local investment in creating those relationships and pushing for that solidarity is even more important with a public health department and with your building inspections department.
And Sophie, if I could also just, Tomas, were you going to chime in?
Oh, go ahead. I'll go after you, Francisco.
I was just going to echo what you said about building power and how that needs to be centered. And I feel like, and so that's why I mentioned many groups should see if there's a local group or a local campaign, a local coalition that they can collaborate with and, add a piece to it. I think what the health framing that is in this toolkit does is that it really points to that everybody has a stake in this. It's not just a renter's rights issue. This is a public health issue. And we're all, obviously the pandemic has frayed that understanding that public health is for the whole public. But even given that, I think it's where when people think about renters' rights, it's even more siloed, right? And so I do think the health framing makes it point out that we all have a stake in this, and that the outcomes are for everybody. Everybody benefits when all renters are healthy. And, you know, so I'll say.
That's right. Just double down, build power.
Great. Thanks, Tomas. I was going to say, if you could do it in 30 seconds, but that was even faster. 5 seconds. Great. Build power. Great note to end on. Thank you all so much. I know you've already shared your contact info in the chat. If you want to drop it in again, if folks can follow up with you. Thank you all so much for your excellent support and work on this toolkit, and for everyone's excellent questions. We will definitely circle back to them as well. And yeah, keep them coming in the chat. I'm going to pass it to Will to close this out.
Can I just add something really quick?
Yes.
Go for it, Lupe.
Sorry, so sorry. Definitely, if folks need like organizations like each other to speak on these issues to your organizations, coalitions, your governments, whatever, please reach out. Like, this is a kind of like inner peer learning that we need to be doing from each other. So please reach out if you need us to, you know, speak to your organization, whoever. So just sorry, Will, back to you.
No, it's okay. I had a number of slides on the call to action part, and I think all basically they say is build power, right? Like, I just want to like second what our advisors are saying. And I think there's like a number of opportunities to do that. I think for those of us that can, doing direct advocacy alongside coalitions, alongside tenant organizers, or if you are a tenant, one of those organizers, like inviting those of us from public health to come and join you. On a previous call that we had with Francisco, I think he brought up a really important point, which is like, there's that external advocacy, and then there's internal organizing. Like, a lot of what we need to do in the public health sector is do our internal organizing to get our organizations, our institutions, our sector on board, and ask ourselves that question of like, what does it take to become a pro-housing justice organization, to build the buy-in, to define your organizational priorities, like get it in your strategic plan, get it in your working plans, join coalitions. And then I think, as you're thinking about that, call us. As I mentioned, like, we're building out our housing justice program, or we have built it out, and we're really excited to engage with folks around the country. So please join us, we can offer campaign support, especially research and communications. I would note we're doing that in a smaller number of places around the country. So, but ask us, right? And we can have that conversation with you. We can help you build support and momentum. We can help you with coaching and thought partnership. And next slide. Next slide. Can you skip to the government organizing one, Sari? Great. I also saw a lot of folks from health departments on the call and from within government, and just want to note, like, sometimes we try to just like sit things out, and we're like, and I speak as someone who spent a lot of time in local government. So the we is like, we in government often are like, actually, we can't take a stance on that. And I just want to say, you can, you should. We can help change practice, we can help change narrative, and we can help change decisions. And then in our last minute, again, for those of you who are either organizers or working in government, we're just launching the latest iteration of our Power Building Partnerships for Health program, which intentionally supports and resources collaborations between organizers and folks working in health departments. If that's something that sounds interesting to you, the application is due January 7th, and you can reach out to those of us on the HIP staff, and we'll make sure that you get the right materials. And that's it. Thank you. Thank you so much for our advisors who helped advise the development of this toolkit. Thank you, Suk and Sophie, for leading this project. It's amazing. I'm finding it super useful already. Thanks to the HIP communications team who helped bring the toolkit to completion. And thanks, Monica, who did a lot of the research, and then Reina, who did the graphic design. Thanks, everybody. Have a good day. And we look forward to collaborating with you. Bye.
Thank you.
Well, I think somebody asked about making the recording available. Will it be available at some point for folks?
Yes.
Yeah, sorry, I saw your chat, but was trying to do too many things at once. Yes, I think so. Advisors, are you guys okay with that?
Great. Thanks all.
Thank you, everybody.